Hi, this is Dr. Gair of LaserChiropractic.net, and today I wanted to share with you some information about gluten-free dieting, or gluten-free living, actually would be more correct to say. You've probably heard a lot about this in the news lately with celebrities like Miley Cyrus crediting that with her weight loss and with an increase in energy. You hear other celebrities talking about how it's helped them clear up their skin. There's a lot of misinformation out there about what gluten-free living is. You'll hear some people saying they can be extremely dangerous, which any diet, if done improperly, could be dangerous. But what I want to go over today is what gluten-free living is, and if it's how to know if it's something that you should try, and also how to do it properly so that you don't run into some of the pitfalls that many people trying a gluten-free diet do run into. Now, before I get into that, I just want to share with you my story about how I came to be gluten-free and what led me on this path. What I started to notice several years ago, before gluten was even on my radar as something that could cause some problems, was that I had increasing reactions to foods, especially if I was eating anything that had bread with it. In the past, I had done Atkins type of dieting about 14 years ago and done really great with that. While other people had said that they felt really fatigued, I noticed that I felt great. I felt really good when I eliminated all those carbohydrates. I thought it was just from cutting out the carbs, but now in retrospect, I realized that what was really happening was I was eliminating foods that contained wheat gluten, and that was why I was feeling so much better on a low-carb diet. So, going back, what I was starting to notice was that, let's say if I went to Subway and had a sandwich, I would feel bloated afterwards, I'd feel a little fatigued, I could feel great before I would eat the meal, and afterwards it just didn't feel as good. Another thing I noticed was that my pants wouldn't fit as well, whether it was at Subway or if I went to an Italian restaurant and had some pasta, had some garlic bread, all of a sudden I'd get some swelling, I'd get some fatigue. Many times I'd have to go and take a nap, and I'd also get some muscle pain and joint aches that would also occur. Brain fog was another thing. Problems with concentration started to occur when I would eat these foods. The worst example would be when I would eat my favorite food, which is pizza. When I'd have that as a treat, about 2 slices into it, I would start to get a rapid heart rate. My heart would beat irregularly. I'd also get some severe abdominal discomfort, and I'd have to run to the bathroom, and I'd spend the rest of the night in the bathroom. The funny thing about it was I loved the pizza so much I'd go back and finish the thing off. So I didn't learn my lesson. But what I was not aware of at that time was how serious was the damage that I was doing to my body by eating those foods. I thought it was just a little lactose intolerance or a little reaction to the pizza. Not a big deal. I thought it would go away. But what was really happening was my body was mounting an autoimmune attack against the protein in the wheat gluten. And not only was it attacking that protein, but it was also attacking my own gastrointestinal lining. And from doing some other testing, I found out that it was also attacking my thyroid. So here I was just eating a food that I thought was just a cheat food to keep my sanity when I was trying to eat healthy, and I was actually damaging a lot of systems with my body that was impairing my ability to absorb nutrients and affecting my health in a really negative way. So there are some people that may be out there who are going through these same things, and what I wanted to do here is just give you a few of the different symptoms, which you can get this if you go onto celiac.org. They have this little pamphlet there, and you can download this PDF, and this you can go over and see what some of the symptoms are to know if you may have problems with wheat gluten. So this is the best way to know whether or not you should maybe try doing a gluten-free diet. For example, if you have bloating that occurs after eating, and if it's recurring, especially, not like a one-time thing, but if this is something that you notice when you eat certain foods, especially if they're foods that contain wheat or flour in them, or barley or rye, if you get bloating, gas, or abdominal pain, if you get alternating bouts of diarrhea or constipation, or if you've been diagnosed with ulcerative colitis, irritable bowel syndrome, there's a good chance that this may be something that's affecting you. If you have difficulty losing weight or gaining weight or both, it's going back and forth. If you have a pale or foul-smelling stool, if you have an unexplained anemia, we see a lot of patients that'll have that they'll come into the office and they've had anemia for years and their doctors have tried to give them iron supplementation and still nothing. They still have the same amount of anemia. So that could be that you're actually not absorbing these nutrients because the gastrointestinal tract is not functioning properly due to problems that you can have with gluten. Bone or joint pain, which, as I mentioned, that was something that I had. Even behavior changes like depression or irritability, especially if you notice that when you eat a certain food, if you feel irritable or depressed or have any kind of change of behavior, it's a good sign that you're having problems processing that food. Vitamin K deficiency, Fatigue, weakness, or lack of energy. We see tons of patients that complain about that. That's a super common complaint, is fatigue, weakness, or lack of energy. Now, I'm not saying that that's always caused by gluten, but this is one potential cause of that besides other causes that are out there too. For kids, delayed growth or delayed onset of puberty, a short stature, failure to thrive in infants, infertility, irregular menstrual periods, spontaneous miscarriages, canker sores. That's something that I used to suffer from a lot when I was a kid, all the time, and I don't have them at all anymore since I've eliminated the wheat gluten. Then the canker sores are inside of the mouth, or also tooth discoloration and loss of enamel. Those are some of the symptoms that, if you have some of those symptoms, there's a chance that you may have either just a gluten intolerance or possibly a full-blown celiac disease. And now, celiac disease is something that I remember when I was in chiropractic school, they told us was really rare, and you probably wouldn't really see anybody with it. But we now know that that information is completely inaccurate, because according to celiac.org, which is a national organization for people with celiac disease, we know that about 1 in 133 people have full-blown celiac disease. Now, what that is when your body actually can't process the wheat gluten protein, and that's a protein that's also in other types of flours like rye, barley, spelt. So your body has an inability to process that, and it'll actually mount an autoimmune reaction to it. There's a common misconception that it's just an allergy, and actually when Miley Cyrus talked about her problem with gluten, she called it an allergy, which that's really kind of a misnomer if someone has celiac disease, because this is actually an autoimmune condition where what the body will do when you take in that gluten protein, it's actually technically called the gliadin protein, but it's commonly known as gluten, your body can't handle it, and so antibodies will be released. These antibodies will then mark that gluten protein to be destroyed. What can happen is it can also mistakenly tag different tissues for destruction. It can tag gut tissue, thyroid tissue like it did in my case. It can tag joint tissue. In some cases, it can even tag brain tissue, such as cerebellar tissue. So many different systems can be affected by this, and by taking in this molecule, you can cause your antibodies to tag these tissues for destruction. Then you'll have other immune systems cells that will come out and will actually destroy that tissue. So as the tissue is being destroyed, you can actually erode the lining of the gastrointestinal tract, and so people start to notice now that they have more problems with eating foods that they used to be able to eat. They may have more sensitivities to spices or reactions to foods they didn't used to have. You can also destroy thyroid tissue, which can start to create different problems with the thyroid, a sluggish thyroid, or even there's some links between this and even Graves' disease as well. Some people do notice even problems with coordination and balance and function in that way. So this is 1 in 133 people have this type of reaction. Now, there are estimates that, with some studies say that anywhere from 1 in 3 to 2 in 3 people have just a simple gluten intolerance or gluten sensitivity because they have what's called a leaky gut, where their digestive system is not functioning properly, and that can create reactions to wheat gluten as well. So again, if you had any of those symptoms, I'd highly recommend you to think about trying a gluten-free elimination diet. Now, obviously, before you do any of this, I highly recommend that you do see your qualified healthcare practitioner and don't try to embark on this just on your own, because you're going to have a lot of questions. If you're in our area, you're welcome to come in and set up an appointment with us, and we can help guide you through this process. Now, there's a great resource for you. Again, that's celiac.org, and there's a lot more information that'll go more in depth than I'll have time here on this webcast to tell you about problems with gluten. I went over the symptoms on there. Now, one thing you can do to really see if gluten is affecting you is you can do what's called an elimination and provocation diet, to where for 3 weeks you eliminate all sources of wheat gluten, and that includes any kind of breads, any kind of pastas, anything that has wheat in it, and also anything that has rye or barley. Now, the trick here is that a lot of things have gluten in them that you wouldn't think of, such as soy sauce. Soy sauce's second ingredient is wheat, so you're going to have a lot of wheat gluten in there. Barbecue sauces, because they have caramel coloring, and the caramel coloring is made from barley. So I highly recommend you go onto the celiac.org site, and you can read about what kind of things you need to look for in the labels. I'm also going to put some little ones up here listed off to the side as I speak for you to be able to watch out for. Now, you do this for 3 weeks, and you have to do it very strict. You can't just cheat a little bit. You can't even have like a little drop of gluten, like even a bite of bread, because that one bite can cause you to form antibodies if you do have celiac disease, and then that's going to completely throw off the test, where you're not going to know if there's any kind of a change. The other problem with the elimination diet is that for a lot of people, their antibody reaction can last anywhere from a few weeks to several months to even up to 6 months. So it may not give you a full picture. That's why one of the things I do recommend, if you hit a lot of symptoms on there, on that list that I gave you about potential symptoms you can get if you have problems with wheat gluten, is Cyrex Labs has this test called array number 3, and that's specific for seeing how you react to the gliadin protein, which is gluten sensitivity or gluten intolerance. You can run that test. They'll charge you, I think it's like $375 for it, but that way you take all the guesswork out of it, and then you actually do know if you have a reaction to wheat gluten. And the nice thing about their test is there are many different forms of the protein, and they can tell you exactly which one you're reacting to. And you can also click on the PDF file next to that and see what tissues that targets for destruction, because some of them will target, again, gut tissue, some will target thyroid tissue, some will target brain tissue, others will target hair and skin tissue as well too. Some people have reactions on their skin or hair loss that's caused by reactions to gluten. So that's with Cyrex Labs. They have a really good program over there that can help you get tested. Now, one thing you recommend also in the elimination diet is that people give up dairy and also soy, and the reason for that is because when a person does have celiac disease or they have gluten sensitivity, then the gastrointestinal tract is not functioning well, and it can actually have more problems processing lactose and the protein molecules than a healthy gastrointestinal tract can. Same thing with soy. There's a lot of cross reactions as well too. If someone has a gluten intolerance or a full-on antibody reaction to it, soy, corn, and even eggs can also cause some cross reactions there. So that's why for 3 weeks we recommend that people try eliminating those all those foods. Apex Energetics has a really good program. They have 2 programs. One is called the RepairVite program. That is great for helping to repair the gastrointestinal tract while you're doing the 3-week gluten-free challenge. Another one is the ClearVite formula that helps to detoxify the body. You can go to apexenergetics.com and read more about that. Now, a lot of people ask, is this something that you have to do for life? If you have the antibodies against gluten, absolutely, this is something you have to do for life, and you have to be strict about it. It's not something you can mess around with, because like in the case with me, eat 1 slice of wheat containing protein, all of a sudden I get a heart reaction, the thyroid's being destroyed, and gut tissue is being destroyed. So it's not a diet you can cheat on if you have the antibodies. That's why I recommend the testing from Cyrex Labs, because then you know how strict you have to be with a gluten-free diet. If you don't have the antibodies, then you may just have what's called a leaky gut. And if you do an elimination diet for a period of time, do the RepairVite protocol that Apex has, you can have to heal up that gastrointestinal tract, and you may be able to be someone who can handle wheat gluten. You don't have to completely eliminate it. So again, that's why I recommend that. Now, this is going to be part 1 of the gluten-free dieting. This was just to try to explain to you what it is, give you a couple resources at celiac.org. The next section, I'm going to get into what you actually can eat, what you can't eat, and how to devise a menu on there. So thank you for your attention, and if you have any questions, please feel free to email me. You can contact me through the website, www.laserchiropractic.net. Thanks, and have a great day.